Acentra Health is the beneficiary and family-centered care quality improvement organization for the 29 states shown on this map. We perform three services for Medicare beneficiaries: appeals, quality of care reviews, and immediate advocacy services. Acentra Health Sanction reviews are official evaluations conducted when a healthcare practitioner, facility, or agency fails to meet professionally recognized standards of care. These reviews ensure that Medicare providers adhere to federal rules, such as preventing unnecessary services or addressing severe patterns of poor care. The primary components of the sanction process include: 1. Review initiation. Acentra Health identifies a potential concern, usually through a formal Medicare beneficiary complaint or a pattern of problematic care. 2. Opportunity to discuss. Before making a recommendation, Acentra Health is required to notify the provider, who is given the chance to review the evidence and discuss the case. 3. Corrective Action Plan, or CAP. In many cases, Acentra Health works with the provider to implement a CAP instead of immediately seeking a penalty. 4. Escalation. If the violation is deemed gross, flagrant, or persistent, Acentra Health will recommend sanctions to the Department of Health and Human Services Office of Inspector General, or OIG. 5. Potential penalties. The OIG holds the final authority to impose sanctions, which can range from monetary fines to total exclusion from the Medicare and Medicaid programs. How does the BFCC-QIO sanction process work? When Acentra Health reviews a quality of care complaint, the case is first sent to a physician reviewer for evaluation. The physician reviewer determines whether the case involves either gross and flagrant violations or a substantial number of substantial violations. If the initial reviewer identifies either of these concerns, the case is then reviewed by 2 additional physician reviewers. If 2 out of the 3 physician reviewers agree that the case may qualify as a potential sanction case, the provider is formally notified. At this stage, the provider has an opportunity to respond. The provider may choose to submit additional written information or request a face-to-face meeting with Acentra Health. Next, a sanction panel made up of physicians is convened. The panel assists in evaluating the case and determining whether a sanction violation has occurred. If the panel determines that no violation occurred, the case continues through the standard quality of care review process. If a violation is identified, the provider is placed on a CAP. The CAP may require the provider to submit data and demonstrate compliance to Acentra Health over a designated period of time, typically 1 year. Once the CAP meets the required data elements, the case is closed. It is important to note that if the CAP is not completed to the satisfaction of Acentra Health, the case may be referred to the OIG for potential sanction action. The sanction process is designed to ensure accountability, improve the quality of care, and support compliance with Medicare standards. If this video was helpful, please subscribe. Click the notification bell and you'll get notified whenever we post a new video. Thanks for watching. If you have questions about Acentra Health or resources we have available for healthcare providers, visit acentraQIO.com/providers. The YouTube video description also has useful links and additional information.